Yeah, and we'll go ahead and start, and as and when people come in, that's fine. So thank you all for joining me on my first mental health forum. Just so it would be good if we can do introductions. I'll start with myself because I don't know if I've met everyone. So my name's Whitley. I'm the volunteer coordinator at Ealing and Hounslow CVS. So I'm currently running both Hounslow and Ealing Volunteer Centre. So my role is kind of to support groups in finding volunteers and with training around volunteering, and also to support volunteers in finding opportunities, and with some training around volunteering as well. So yeah, this is my first mental health forum. I mean, unless you saw me in the past when I did it in person, but this is my, first sort of one online. Can I start with Ellie? If you could give a sort of short introduction.
Hi there, my name's Ellie. I'm from Ealing IAPT. I'm a community engagement officer, and I'll be speaking a little bit later a bit more about what we do, who we are, and where we fit in terms of mental health in Ealing.
Great, thank you. Helen?
Hi everybody, I'm here from the West London NHS Trust. I'm one of the transformation team, and I'm here to talk to you about the Hope and Horizon project, to give you an update and sort of get your feedback. I've got Richard here who's with me. I think he's just managed to get in the meeting.
Yes, I think he has.
So we're part of the project team, and we'll be talking to you about that shortly.
Great, thank you. Julie?
Hi, so I'm Julie. I'm the Mulberry Macmillan Cancer Information Support Service Manager, great long title. Our community engagement lead is actually on annual leave today, so I'm here in her stead. And again, I'll do a presentation about the Mulberry Centre and its services shortly.
Great, thank you. Phil?
I'm Phil Kitley from Ealing Rise, which is the Community Drug and Alcohol team, and I'm the team leader for the dual diagnosis team.
Great, thank you, Phil. Happy?
Good afternoon all. I'm social prescriber for Ealing. I work with 10 surgeries and I'm here with my colleagues. Thank you.
Thank you, Happy. Eleanor?
I'm Eleanor. I'm a new social prescriber. I work with Happy in the North Southall PCN, and Sonia as well.
Trudy?
Hi, I'm Trudy. It's the first time at this forum for me as well. I work in MASH, which is multi-agency safeguarding, so I'm the mental health advisor, and I'm employed by West London NHS Trust.
Great, thank you, Trudy. Emma?
Hi, I'm Emma. I am a family support worker for Ealing Copley Close Children's Centre.
Great, thank you. Anne?
Hi, I'm Anne Owen, independent mental health advocate from Mind in Ealing.
Great, thank you. Sonia F.
Good afternoon, everyone. I'm Sonia. I'm a social prescriber and link worker for the North Southall PCN.
Thank you, Sonia. And the other Sonia?
Hi, yes, I'm Sonia Dillon. I'm a social prescribing link worker. I work with Happy, Sonia and Eleanor.
Thank you, Sonia. Hayley?
Hi everyone, I'm Hayley. So sorry having camera issues on this Friday afternoon. I'm the lead community mental health link worker for West London NHS Trust. It's lovely to meet you, Whitley, and also unfortunately the Ealing Mint link workers couldn't make it today, so I'm here representing.
Okay, great, thank you. Nyoka?
Hi, I'm Nyoka Lewis, and I've joined the Ealing Council, working on a new project with them, the Ealing COVID vaccination program, that I'm here to talk a little bit more about the project. Thank you, Whitley, for inviting me on. Thank you.
You're very welcome. Have I missed anyone? No.
Although I introduced Richard, Richard hasn't introduced himself, so maybe you'd like to say hello.
Yes, sorry, thank you. Go ahead,
No
Richard.
worries. Thank you, Helen and others. Sorry I'm late. I was in the other, or waiting the other link. Apologies. I'm Richard Mountford, Deputy Director of Communications here at West London Trust.
Thank you, great for that. Okay, so we've had our introductions. I know we're a bit ahead of time, but that's fine. So Julie, if you wanted to go ahead and start, that's
Share.
fine.
Yeah.
Yes, please.
Yeah, perfect. Okay. Okay, am I sharing the right screen? Can everyone see that?
Yeah.
Okay, so I'm Julie Quinn, great long title, it took me ages to remember that, but I work at the Mulberry Centre and we're situated on the grounds of West Middlesex University Hospital. And what we are is a local cancer information and support service. We're an independent charity that provides practical and emotional support for anyone that's affected by cancer. So that would be to anyone that's living with cancer, it would be to carers, their family and friends, and anyone that's bereaved due to cancer. We also have, and again, I'm not so sure how relevant it is to this group, but anyone that's living or being treated in the Hounslow area with an end-of-life diagnosis, we can give ongoing support right the way through. And anyone living or working in the Hounslow area that has suffered a bereavement, we can also support them. So again, all our services are free. There are no postcode boundaries for anyone affected by cancer. As long as you can get, obviously here, you can take part in the face-to-face, but we also have quite a lot of remote services that you can access online. It doesn't matter where you're being treated, and clients can self-refer. So although a lot of our referrals often come from social prescribers or GP surgeries or the hospital itself, someone can ring us up and say, actually, I need help, can I register with you? And we can go ahead that way as well. So we offer quite a bit of support. It's wide and varied and it's ever changing. But we at the moment, so our core services, if you like, we offer counselling, and we offer that in form of one-to-one, which is face-to-face and remote. When we first came out of lockdown, it was all face-to-face. Everyone was desperate to get into the centre. And now, interestingly, I think with COVID rates spiking again, we've had a bit of an influx of people that want that remote one-to-one support. So we can do that. We also have support groups that we run, and we have a bereavement and end-of-life support as well. So bereavement counselling. We offer lots of complementary therapies. So we've got two beautiful treatment rooms here at the centre where we offer aromatherapy, massage, reflexology, shiatsu, acupuncture and Reiki. We also offer aroma sticks to clients. So aroma sticks can typically help with things like if you're going through surgery, going through treatment, it can help with nausea. We have sticks that help you sleep better, sticks for anxiety, to help, other sticks to help you focus. So basically we can tailor, make a bespoke stick for our clients depending what they want or what emotions they're kind of dealing with. We also offer remote one-to-one support in the form of emotional support. So we're just someone will tap in and give you a call just to check that everything's okay. Emotional freedom technique we offer, which is a tapping technique, which helps reduce anxiety. Counselling again is remote. Aroma sticks I've already spoken about. We do a relaxation and breathwork course, which is a 6-week course where it's just a short 20 minutes once a week for 6 weeks, where they teach you lots of different techniques to help relaxation. We offer befriending calls. We have a soul midwife for end-of-life support, and we can offer legal advice, and that's all done kind of remotely. We also have support groups. We have a patient support group, which runs every week. We have a carers support group and a bereavement support group, and they tend to run every other week. And then we have a men's support group, and again, that is for anyone affected by cancer. So the men's support group is just guys, really. So whether you have cancer or diagnosis, or whether you're living with someone with a cancer diagnosis or whatever. So it's just a kind of a group for guys to tap into. And then regularly we offer things like coffee mornings once a month. We do health walks once a week. We do lots of art classes in the form of watercolor class. We have a drawing class. We have a mandala workshop as well. We offer creative writing sessions. We do lots of different types of yoga. We do men's yoga for prostate health. Randomly, we called it a men's yoga class. Nobody turned up. We decided that actually let's call it a men's yoga for prostate health. And we've got guys ringing up and saying, well, I haven't got prostate cancer, but can I come to the yoga class? So I don't know what happened there with the title, but it definitely made a difference. So we do a men's yoga class. We do a seated yoga. And we do a yin yoga class, which is more kind of breathing techniques. We offer Tai Chi once a week, Pilates twice a week. And so there's lots of movement things going on, and a book group as well, which meet once a month. And we've got various ever-changing workshops. We're so lucky because we can be more reactive. So where there is a need for certain things, we can put that on. So at the moment, typically we're doing a headscarf tie-in workshop. We run a post-surgery bra fitting sessions. So people, once they've had surgery, they can come and have a bra fitted. Or how people grieve, nutrition and cancer, managing stress, nutrition and happy hormones. And we've just recently, we got a pot of funding for health and exercise to improve. And we've run a gaining strength and balance program. And it's great for people that have had surgery, have had chemo, and they've had a muscle wastage or bone or things like that. And it's not kind of obviously weightlifting as such, but it's more about being able to suddenly, to now I can reach up and get that can out of the, or I can lift the kettle. So it's smaller movements, it tends to be. And we just started that, and we monitor at the beginning, we monitor at 6 weeks, and then we'll monitor again at 12 weeks. And the first group have come to their 6 weeks, and the difference in ability and range of movement is absolutely amazing. So that's, in fact, it's better than we ever dreamt it would be. So we're desperate to see now what happens at the end of it. But that's doing very well for us at the moment. And that's about it, because I think I only had 10 minutes. So yeah, any questions?
Great, thank you, Julie. Does anybody have any questions for Julie? Someone's got their hand up. Hayley?
Hi, Julie. You mentioned that you offer grief and bereavement counselling. Are there also support groups for the loved ones of individuals who might have a cancer diagnosis or are nearing the end of their life?
We do. So we have a bereavement support group. We also have a patient support group. And typically, the thing with our counselling, just to say, is it's usually 6 weeks. So we have an assessment session, and then you only have 6 counselling sessions. And that the purpose for that, it's kind of, to deal with a cancer diagnosis or to deal with somebody with a cancer diagnosis. When it comes to end of life, if you're being treated in the Hounslow area or live in the Hounslow area, it's pretty much ongoing. So people with a mental health diagnosis is typically not the best place to come for us, because we are kind of shorter in the moment kind of counselling services that we can offer rather than anything long term. So if somebody needs something more long term, we're not the place, unless of course you have an end of life diagnosis.
Okay, thank you, Julie. Does anybody else have any questions? Yeah, somebody else has got their hand up. Eleanor?
Hi, thank you, Julie. I was just wondering, do you have a waiting list for counselling services?
We do, and it's variable. Again, if someone's got an end of life diagnosis, they are prioritised. I think we've got a 3 or 4 week waiting list at the moment, but because I think we have something like 25 counsellors. And again, we've got 2 beautiful counselling rooms, which we're open, which I haven't told you, we're open from 10 till 5, Monday to Friday, and we open till 8 o'clock at night on a Wednesday evening. So if anyone's working, they can still access our services. So, and because people have 6 week session, all of a sudden you've got a 3 week wait, and then all of a sudden it can just be that, it changes, and now the waiting list has gone right down to sort of 0. And we do have situations where people can get seen within a couple of weeks. But if we can prioritise as well, so if there is a need, they will go to the top of the list.
Okay, great, thank you. Anybody else? No, okay. Well, thank you very much for that, Julie. It was really great for us to hear about the services you guys are running over there at the Mulberry Centre. Just quickly before I move on to the next one, I know there's a couple of people that came in slightly late. I think one at least. Aisha or Aisha, would you mind just giving us a quick introduction?
Hi guys, I'm from Ealing Kate project as well as WWZ. I'm the mental health and recovery wellness worker. I was using the old link. I think there's 2 links.
Yeah, sorry.
That's all it was. So no problem at all. So I'm just trying to listen in now and just catch up. And then if I need to say anything, I'm sure I can chip in.
Yes, and thank you. And just to say, the session is recorded and I'll send you guys out the link following the session, so you will be able to, listen to anything you may have missed. Was there anybody else that came in? I'm not sure, I can't tell now. No, maybe not. Okay, so the next person on the list is Helen. So Helen, do you need to share?
Hi. Hi, yeah, I've got some slides I'll put on the screen. You've got Richard and I here today to talk to you about this project for acute inpatient mental health beds. So if I just quickly share the slides.
Yeah, that'd be great, thank you.
There we go. Can you see that okay? It should be a blue slide saying Ealing Adult Mental Health Beds, yeah? Super.
Yeah, we can see that, yeah.
Right, okay, so we're going to cover this in 2 sections, and the idea that we're kind of bringing you is to tell you, if anybody doesn't know about the project, what it's about, but we have been to this forum before, but it's to update you really on where we've got to with the project, and also to give you some sort of information about how we're going to move on, because we're nearing the end of one stage of the piece of work, and we're moving on to the next stage. So it's to tell you about our thoughts for that next stage, and also to get some input and some feedback and some questions and some early sort of thoughts about that. So I'm just going to take you through the first bit, which is to tell you a little bit about what we've done so far. So I'm one of the transformation team at the West London NHS Trust, and I've been leading on this project, which is about the Hope and Horizon wards, essentially, at the Wolsey wing of St Bernard's Hospital. And what happened is in March 2020, these wards were suspended, mainly because of the pandemic, in that they couldn't be made safe for infection control, for COVID, and all sorts of staffing issues. So those wards were suspended, and some alternative provision was put in place on some of our other sites. So then what's happened out of that is that we've had this piece of work which has said, okay, so what's our longer term position? Because actually the wards were not brilliant in terms of the environment that they provided for the patients. There was always an idea actually that we were going to change the provision and improve it to improve patient care. So we thought, okay, let's have a look and see what we do in terms of the overall provision for a sort of, not an interim, but a sort of determined outcome. So in autumn 2021, what we started doing is looking at all the different sort of options that there might be for that. And we sort of as a team and as a trust, the partners came up with some options and thought about, what might be possible in terms of outcomes. And then we started to go out in early engagement. We've got there 280 individuals, and that was really just a small engagement of our sort of partners and known groups that we work with, to sort of talk about our thoughts about what the long-term options might be. And that included service users, carers and staff, and voluntary and community organisations. And what came out of that actually is that there was a lot more input into the options list that we had come up with. So then coming into the spring, we came up with a longer list of options than perhaps we'd initially thought of. And we started to develop those and have a conversation and try and score and refine down actually, what could those outcomes be? And during those conversations, there were some sort of key themes that came out. Key concerns that people had. Prevention and early intervention was one. There was a bit of concern about making sure that there was adequate support in place for that. Also in crisis, because what happened is because of the suspension of these beds, we didn't have any acute inpatient sort of provision in Ealing. So it was about saying, making sure that there is those provisions locally. And again, leaving hospital and post-discharge support. Again, it's when people then come back into the community, making sure that those provisions are in place. impact of travel for service users and carers, people going to visit those patients that are in an inpatient setting and how they access those, and then the care and support that they receive. And again, that links back to the kind of the environment really, and the sort of provision and the services and the amenities, I suppose, that are available to people visiting or staying on the inpatient wards. So the impact of the engagement so far, like I mentioned, we've talked to those sort of 280 individuals. We developed the options, and what we added is from our early engagement, we added options to keep a service in Ealing, which is something that we hadn't originally put down as our list, either in an existing building or a new purpose-built building or a required building. So that was something that came out of engagement. So we added that to our options for consideration. And also funding some non-bedded support in Ealing. So that's looking at those key themes really and saying, okay, what additional funding can we put in to bolster those crisis or early intervention type of provision within the borough. Then we had some other sort of criteria that we added to it about patient outcomes and safety, convenience and accessibility. So we added some criteria as well in terms of how we then looked at this project and piece of work, and minimising the impact and care closer to home as well, some kind of key themes that came out. And then creating solution there. So we've then been exploring actually what we can do in this kind of current phase that's coming to an end, and looking at actually just things like travel solutions. So we've worked up some different options for how we might mitigate that, and one of those is a reimbursement scheme. So we can help people travelling to these other sites that are perhaps further away out of the borough. We can help them with the costs of additional public transport, or if they need to take a taxi or things like that. So we can actually sort of mitigate any expenses, and also work with our partners to sort of develop options for volunteer driver schemes. So this, if there's people around that can help, take somebody from point A to point B, that could be another option. So there's lots of solutions that we're now working up that have come out of those early engagement conversations, that we're taking forward to the next stage. So the outcome, so we had like I say, we've been developing this list of options, and the outcome was that there was a sort of multi-organisation as part of a panel. So lots of different stakeholders kind of met and went through the different options, including the trust and the local borough, and we had sort of other organisations represented, and they looked at them and arrived actually at the most preferred option, which was to keep the interim arrangements that have put in place, to increase the investment that we're making in the wards, in terms of the health place of safety and the single point of access, and make some step down beds more permanent, and also to explore and deliver these mitigations and service enhancements, such as the transport that we've been talking about. There's other pieces of work that have gone around to support the project, like equalities and health and equalities impact assessments. This is just to make sure that we are taking into consideration all groups, and that we are providing mitigations for anybody that's impacted by the changes. The trust board is being kept up to date, and obviously we're going around to meetings like this to try and keep all our partners up to date and let you know about what's coming and how you can be engaged. And also we're developing our plans for future engagement, for service users, carers, key stakeholders. And like I say, we've done a bit of a small engagement, but now we're going to be going forward and doing that a bit wider. So I'm going to pass over to Richard, who's going to talk you through a little bit more about that. Richard, would you like me to continue sharing the slides, or do you want me to take it down so you can put your own up and
I
share?
think it's probably easier if you leave yours on, Helen. I'll be quite quick. So if we just go to the next slide, so slide 6 would be great. Thank you.
Super.
So just picking up from where Helen left off, obviously we are continuing this engagement process. We are, as Helen said, we're coming out to meet colleagues such as yourselves regularly. We also have an email address and some web area on our website dedicated to this specific issue. So it's out there in the public domain. We were very keen to hear from well, anyone, everybody really. So if you go to the next slide, please, Helen. So the specifics around who we want to speak to. As a communications professional, I spend a lot of time saying to colleagues, everyone is not an audience, because whenever I ask someone, who do you want to get this message out to, they always say everyone. But I think, as this slide demonstrates, we're not far off everyone in terms of who this service relates to and how we're trying to speak to those specific people and communities. So we've identified those following groups. I won't read them all out. I have a lot of faith in people's ability to read on a very busy slide there, but obviously we feel we've thought long and hard about, you know, the specific groups and the stakeholders involved in this project. If you just jump to the next slide, please, Helen. So in terms of methods of our engagement process, obviously post-COVID, a lot of the world is much more now online. So we've done webinars and meetings like today. We're also trying to do some face-to-face events as and where possible. We're also, obviously, as I mentioned before, we've got a presence on our website about this issue. We've got an email address, so all thoughts are always welcome. And then we're also going out, obviously, to some of the more formal partners, so local authority, scrutiny panels, and our own trust board, inevitably. So that will all kick off in around the autumn time, when we take essentially back our findings that Helen has just shown off here. I suppose one of the key things to raise, just as a final point, was around the sort of engagement versus consultation. This is it's a very NHS-y or public sector thing about whether you do an engagement process, whether you do formal consultation. I think the key message that I want to get across about that is that we have followed sort of principles and criteria of a formal consultation process on this piece of work. We haven't called it a formal consultation process because, to be honest, it's been around a long time. We've been talking to people about it for a long time. And we feel that obviously all the evidence and the feedback we've had so far would support a formal consultation. It's just more that, you know, sometimes we've got to try and break through some bureaucracy where, you know, if you look at the evidence we've got here, you look at CQC ratings and comments about the space itself, we'd be very happy to welcome people to come and see it themselves if they're in any doubt about what it's like as a facility. I think Helen was being very diplomatic in her description of it. If you look at the standard of patient care that can be delivered in that facility compared to a lot of our other estate, you know, there is a real stark difference. And as I say, when the CQC are, you know, raising it as an issue, it is something that really has to be tackled. So sorry, I should probably go to the final slide there, which has the sort of formal next few steps around EHIA, so the Equality in Health Inequality Impact Analysis. We're doing at the moment. I've mentioned the ongoing engagement with related groups, and then the very formal bit is the business case, obviously, the engagement plan, which will go through various boards and scrutiny panels through September. So it's a whistle-stop tour. I realise, I think as Helen mentioned, this issue has I think been to this forum before. I think it's been through almost every group we can think of multiple times. But it's of course it's a delicate matter for lots of people, and we're very conscious of that. So very happy to take comments and questions from colleagues.
Yeah, and I suppose what we're looking for as part of this particular exercise today, maybe I should stop sharing. Hold on a minute. And we can see everybody's faces. Yeah, I suppose what we're asking is obviously we told you kind of where we are and what our plans are for next steps. I suppose it's you know, any questions on how we particularly need to outreach and engage with any particular groups that you might be thinking of. You know, make sure everybody's heard about it. Any comments on what we've said, that sort of thing would be welcome.
Does anybody have any questions or comments that you want to share with Helen and Richard?
Richard, we obviously weren't engaging enough.
Or very good at communicating.
Or it's very clear.
Should we have done a game to start with?
The one thing I don't know is on the slides actually is I mentioned the web page. I'm not sure the link was on there. I could put it in the chat here.
Good idea.
So if colleagues want to take that away, you know, back to your you know, groups and organisations, obviously, you know, that's probably the place to signpost people to.
Okay, great. Can I just ask Helen and Richard, is it okay if somebody does come back to me, say slightly later on, can I just kind of, you know, signpost them to you guys if they have any questions or, you know, want to share anything with you guys?
Absolutely, yeah. You can give my email address, and people are welcome to contact me directly. And I'll put in the chat as well if I can remember how to do it on Zoom. The sort of generic email address that we've got, because there is a generic one, so that obviously if I'm not around, other people should be able to pick it up. But yes, people are welcome to contact me directly with any questions or follow-ups.
Okay, great. And also, if possible, could you share the slides with me, and then I can share it with everyone as well?
Yeah, absolutely. I'll drop them over on email.
Okay, great. Thank you. So just, lastly, nobody got any questions or comments or anything? No? Okay.
Super. Thanks all.
Thank you guys both for presenting. That was really useful. And again, maybe, after looking at the slides, people may have some questions or comments if they want to share on a later date. So we're going to go to Nyoka, who's going to present next.
Thank you, Whitley.
You're welcome.
And thank you, everybody, for giving 2 minutes or maybe a few more minutes of your time, to listen to me. So I'm sorry I have my COVID face on, so not as planned and prepared as I hope to be. Just wanted to let you know a little bit about my project. Just introducing myself. I've recently joined the Ealing Council. Previously worked with Whitley at the Ealing and Hounslow CVS, which is why I have a kind of a connection and could buy in a time on this meeting, just a few minutes to share some information about the project. So my main idea of coming here today is to tell you that we've launched the Ealing Together Matrix. And what this matrix is a connection between the residents, the voluntary sector organizations in Ealing, and also the council services. So it's got a threefold, layer that we've put in. We'd like to encourage as many groups as possible, voluntary organizations to get on. This would help build visibility for the services that you're offering in Ealing, as well as have residents maybe wanting to would be able to connect with you directly. If you're looking for volunteers, this would be another place where they'd be able to come directly onto connect with you and your service and volunteer their time. The other benefits that we're also looking for, and through this through a questionnaire that I've designed, we'd be able to get your consent if you're willing to look at working with the council services and how closely we could foster this collaboration. One of the main areas, main reasons to put this matrix together, which will be on the Do Something Good portal, would be to encourage closer collaborations between groups in the Ealing Borough, maybe, which would result in partnership, funding, and various other, sharing of your best practices, etc. I will share the questionnaire and the details with Whitley, so she could share it with you. So it would tell you more about what's in it for you to get on board. Sorry, got a bad throat, just tested negative yesterday, so won't do all the talking, but I'll let my little information that I'll be sharing out with to Whitley to do more of it. And if you could click on that link, if you feel yours is an organization that should be on it, do get yourself on board. But I think there's more to how we could try and get the whole borough together in one spot. So thank you for listening to me, and thank you for your time, and thank you, Whitley.
You're very welcome. Thank you for,
happy for any questions if there are any.
Yes, that's exactly what I was going to say. Does anybody have any questions for Nyoka? No.
Okay, thank you, Whitley.
I think we're all trying to spare your voice.
Take care. Thank you.
Thank you so much, Nyoka. Yeah, so Ellie, if you're ready.
Yeah, no problem. I'm just going to share my screen if that's all right, because I've got a presentation.
Great. Thank you.
Can everyone see that, right?
Yes, now we can see it. Yeah.
Perfect. All right. Hi, everyone. I've never attended one of these before, and I'm not sure if anybody from my service directly has, but I'm Ellie and I'm from Ealing IAPT. So some of you may have already heard of us, some of you might not have heard of us, but the purpose of this presentation is just to explain a little bit more about what we do, where we fit in terms of mental health support in the Borough of Ealing, who we can see, and how you might want to signpost your service users to our service to support them with their mental health. So first of all, IAPT stands for Improving Access to Psychological Therapies. So it is a talking therapy service that was developed in 2008. The way it works in London is that there is an IAPT service per borough. So we're the one for Ealing, and then there'll be one for Hounslow, for Hammersmith and Fulham, etc. And then they're dotted all around the country. So there is a lot of us. And we are a primary care mental health service. So that's where we slot in terms of the structure of mental health overall, and we're part of the West London NHS Trust. So we specifically cover Northolt, Greenford, Southall, Perivale, Hanwell, Ealing and Acton. And in terms of IAPT overall, the idea is that we improve access. So we want to kind of see more people year on year. So last year, IAPT as a whole, across the whole country, saw about 1 million new people. And then the next kind of couple of years, we hope to double that, or almost double that, and access 1.9 million people. Our treatment are brief, but they are evidence-based psychological therapies trained by accredited practitioners who all go through a training year. So there are some limits on who we can see. So we are an adult only service. Anyone below the age of 18, we would normally signpost to CAMS. We can also only see people who are registered within the Borough of Ealing with a GP, or who live within the Borough of Ealing as well. So anyone outside that would probably go to another IAPT service, whether, as I said, that could be Hounslow, Hammersmith and Fulham. And we mostly see people that struggle with mild to moderate difficulties relating to anxiety and depression. So people with more complex or severe disorders, so that might be bipolar, a personality disorder, they will tend to go to another team, and that's because they might need more high intensity interventions than what we offer. We also aren't able to see people who are struggling with alcohol and substance misuse. So although we can see people who might, have alcohol and might be a little bit dependent on it to manage their mental health difficulties, we can't see people with with their main problem being alcohol and substance misuse. So we do offer a range of treatments. All of our treatments are brief, so the longest they extend to might be about 16 weeks, but it goes from about 4 weeks or 4 sessions to 16 weeks or 16 sessions. So we can't offer any long-standing treatment, but our therapies are all based around the NICE guidelines. So there are different things that we offer. So we intend to split our therapy from low intensity, then high intensity. So the low intensity therapy is essentially just more short term, and the sessions are a little bit shorter, which might include guided self-help. So that might be about 6 sessions worth 30 minutes each. We also do low intensity computerized cognitive behavioral therapy. So that would be through an online program. And then we do groups and workshops as well. So they might be a little bit shorter, maybe about 4 weeks. And then our high intensity therapy will tend to do cognitive behavioral therapy. So these sessions will be more like 1 hour each for a minimum of 8 weeks, which can be extended. Interpersonal therapy, dynamic interpersonal therapy, behavioural couples, counselling for depression, and then specific trauma therapy. We do EMDR. So we do have a lot of different kind of therapies, and essentially what we would do is we would assess a patient, understand what their needs are. If we feel that we're an appropriate service for them, we would then discuss the most appropriate treatment for them. So it really would depend from person to person and their circumstances what we would offer them, but this is essentially what we do offer. We are not a crisis service, so we cannot see people who are in an immediate crisis, and if someone does access us who is in a crisis, we will always signpost them to one of these places. And if we feel like people can't keep themselves safe, or we're worried about imminent harm to self or to others, then we're much more likely to signpost to either one of these crisis services or to secondary care as well. But the bottom line is that if someone accesses us, even if we cannot help them directly, we will always try to signpost them to the most relevant service. So it's not like we'll discard them. We just might say, we're not for you, but we do know who would be right for you. And so we'd signpost or refer them on. One of our main initiatives ever since IAPT was invented is that we want to support people who might be struggling with unemployment. We do know that there is quite a bi-directional relationship there. So people who are struggling with unemployment might be more likely to experience mental health problems. And then also people that experience mental health problems might therefore struggle with work-related difficulties or unemployment-related difficulties. So on the screen there are just some statistics about mental health in general. Across the UK, and also how it can impact work, and also how it impacts the economy. So as I just said, in January 2021, the Health Foundation, found that about 43% of unemployed people did have poor mental health. So when people come through our service with mental health difficulties and also work-related difficulties, we do tend to refer them to Twinings, or we might signpost them to other places that can help them in gaining or sustaining employment. So now that you know a little bit more about us, it might be useful to know where you might come in terms of your support, or how you can signpost to us. So you may come across a lot of service users yourself who are struggling with mental health support, and you might think, well, where do I signpost them? I'm not entirely sure. Could IAPT be appropriate for them? And the first step in understanding if they're appropriate is also knowing who we are, but also identifying potentially some generic symptoms that people may experience when they're having mild to moderate depression and anxiety. So you're probably aware of these generic symptoms. This is definitely not an exhaustive list of what people experience when it's depression and anxiety. These are probably just the most common symptoms. So there can be common themes as well. So you'll probably see that for both depression and anxiety. There might be sleep changes, appetite changes, concentration changes, changes in the body overall in terms of muscle tension or lowered energy levels, but there are some discrepancies as well. So when we assess people, this is what we tend to look at as well when we're looking at what treatments to give them. So someone who excessively worries or feels like they're out of control with their worry, we're much more likely to give them an anxiety-based treatment. But someone who's maybe more struggling with their mood or with their energy levels, we're probably more likely to give them a more depression-based treatment. So these are just some common symptoms to look out for if you're coming across people. And then finally, just ways to access us. So first and foremost, we would probably encourage self-referral. So you don't need to go through a GP, you don't need to go through anyone in order to access us. You can simply just come to us direct, and you can do that online by filling out our form. That's probably the quickest way, because you can just do that yourself. You don't need anybody else. You can also do it via telephone. Again, you know, our admin team, they're only human. They might have a lot of people to take calls from. They might be on their breaks. So in terms of calling a number, you might not get through to them on the first go. So that's why we would always encourage our online self-referral form. But of course, please call us by telephone. In person, if you want to come in directly and see us, then of course you can come to our address, and an admin team member will be able to go through the referral with you. People can go through their GPs if they'd like, and that's no problem at all. The only reason we encourage a self-referral is because adding a GP is sometimes like adding an extra step, which is going to your GP, telling your GP, asking them to make the referral. And by making a self-referral, you can just cut those steps out. But of course, you can still go via your GP. What we would say is that this presentation that I've given to you, if you feel like some of your team might benefit from hearing more about this, then we would love to deliver this presentation to other members of your team. So if you're thinking, oh, this is really useful for me to know, I'd love for my own team members to know more about this, please let us know, and we'd absolutely love to deliver the same presentation. We also have a flyer that we can send out to you that you might want to pass on to your own service users, just so they know a bit more about us and how they can self-refer to us. But that's everything from my end. Yeah, any questions?
Does anybody have any questions for Ellie? Yeah, Hayley, I think you've got your hand up.
Hi Ellie, I'm Hayley
Hi.
here from the Mint Services.
Hi.
I said that GPs can support. Are you in Ealing? Because I'm not as up to date. Are you quite linked in with the GP services? So if any of our partners are having trouble with, is that sort of the best way for them to help that, you know, their service users access you, if that makes sense?
Absolutely, yes. So we're directly linked in with GP. So a lot of our band 8s, 8 therapists, they kind of have their own designated GPs that they link in with. So yes, we work really closely with the GPs. Yeah.
Great, thank you. Sonia? Bev?
Thank you. Hi, Ellie. I know you didn't mention it in your presentation, but I'm aware that IAPT also do support for long-term conditions. Are you able to tell us about that, please?
Yeah, absolutely. So we do provide support for people that experience long-term physical health conditions. We can support people that have long-term mental health. It's just that we provide brief interventions. So we don't rule anyone out. It doesn't matter if you've been experiencing a difficulty 2 weeks or 20 years, we can still see you, but our interventions are short. But in terms of our long-term physical health conditions, we pretty much do the same treatments for them, but it is very much with an understanding of their physical health conditions as well. And actually, just to say, we definitely also see people who experience any disabilities or any kind of impairments, such as visual, auditory impairments. We also see people whose first language isn't English, so we use interpreters. So we can pretty much see a lot of people, but in terms of the length of the intervention that we offer, it will always be brief, essentially. I hope that answers your question.
Yeah.
Yes, thank you.
No problem.
We've got Eleanor. She's got her hand up.
Hi Ellie, thank you for the presentation. I just had a few quick questions. Firstly, if we refer a patient to you that's struggling and you feel like they aren't quite right, your service isn't quite right for them, do you have a direct link to like the Mint team? Would you be able to refer directly into them, or would the referral come back to us to then refer onwards?
No, we can do direct referrals to other teams such as secondary care or Mint workers. Often it might go a little bit by secondary care first, but I believe that we can refer directly to you. That shouldn't be a problem.
Cool, thank you.
No problem.
And just, I know that you mentioned you had some leaflets about your service that we might be able to give to our service users. Would you be able to share that with us, please?
Yeah, am I able just to share stuff in a chat, or is it better to email you, Whitley, and for you to email on?
You can share in the chat, but if you do email it to me as well, then I can also send it to everyone that may have not been part of the meeting.
I'll do that.
Great, thank you. Also, Francis has got his hand up. Sorry.
Hi, yes, thanks for a really good presentation. Just wondering what the sort of average wait is once somebody self-refers or we refer them.
Yeah, great question. So for low intensity therapy, which, to just be really generic, is for like mild to moderate difficulties, it's probably about 4 weeks, and that's across different modalities. So whether that's one-to-one over the telephone or group or computerized CBT, so that's about a month. And then high intensity therapy, which generically is like our longer therapies, that's between 2 and 3 months. So there's a bit more of a wait for that, for various reasons, but low intensity 1 month, high intensity 2 to 3 months.
My next question is a little bit more specific. I was wondering about people with eating disorders, whether you see them, and or people on the autistic spectrum.
We definitely see people with autism, absolutely, that's no problem. People with eating disorders, so this definitely differs from IAPT to IAPT service. I haven't been at this one very long, but what I do know is we don't see eating disorders, but we will refer on for eating disorders. But other services, so the previous one that I worked at in Wandsworth, we saw for binge eating, we could see that. So it does differ between each service, but for this one specifically, my understanding is we don't see eating disorders, but we would refer them on to an eating disorder service.
Okay, thank you.
That's fine.
Thank you. I had one question, Ellie, and it's just sort of, if you are kind of supporting somebody and say they've got to the end of their say they've hit 16 weeks or whatever their period is, and either they felt like they needed extra support, is that an option, or do you just refer them on to somebody else, or what's the procedure in that case?
So normally we probably would signpost them onto someone else that can offer more long-term support. What we tend to encourage our patients who have reached, I suppose, the recovery threshold but would like more support, is we do tend to say to them, like, you know, go off for a couple of months, keep trying out the techniques, and if you're still struggling, then come back to us. But obviously that is a re-referral process. So unfortunately, you know, that does happen where people do reach the end of their time with us, and we can't provide them with any more sessions. So all we can do, just within our structure, is either a referral signpost them on, or let them kind of have a go on their own for a while, but then come back to us. So people can re-refer as many times as they want. That really doesn't matter. But understandably, it's like going back to the bottom of the queue, which isn't ideal, but we are a little bit limited in terms of our funding, but also what we can offer.
Great, thank you for that. Hayley, did you have another question?
I did, yeah, sorry.
Okay, no, it's all right.
Disorders point, it's more for everyone really. I wonder if between us, could we have a bit of an updated list of what services there are, you know, sort of community and charity organisation wise in Ealing specifically, if there are any, and if there is, because I'm not actually sure, is there a secondary service? I don't think West London offers one unless CAMS does, but that would be good to know as well if anyone does know, just so we've got a bit of an updated list, because it's something that comes up a lot. We're not always really sure where to refer to.
Yeah, okay, great. So if anybody does have any sort of information around that, could you please send it on to me, and then I can kind of share it with the group. Yeah, so if anybody does, you know, even if you just come across it, please do just share it with me, and then I can share it with anyone. Or if anybody knows anything right now, then you can by all means share it with us. Does anybody else have any questions for Ellie? No. Okay, great. Thank you so much for that, Ellie. That was really useful.
Problem. Thank you, everyone.
Yeah, so we've come to the part in the forum where it's updates. So it's updates from members that have attended. I just wanted to give a quick update. I mean, some of you may have heard this already, and it's about a supported volunteering program that Ealing and Hounslow CBS will be working on. It's not a sort of project that I'm personally working on, but I've been asked to share with the group from my colleagues. So I will do my best to kind of go over it, but please do excuse me if I can't answer, you know, everyone's questions. Okay, let me share my screen quickly. So yeah, just to give you guys an update about the project that will be running, and it's a project called Give Back to Feel Better, and it's a volunteering program. And this is a new program that we've, you know, just introduced, so it's just kind of starting up. So the project is for individuals aged 18 to 25 who are living or studying in Ealing, and who are currently struggling with low-need mental health problems. We are looking for members from the LGBTQ community and those from minority, ethnic, Black and Asian communities as well. So it is basically a supported volunteering program that will offer people 12-week volunteering placements, and that will be for, you know, they can either volunteer within the West Ealing Library or within other sort of organisations within the borough. And it is increasing experience levels in certain fields and learning new skills, and improving general mental health and well-being, It's basically created to help people make friends and working with new people. Also, it helps the organisation and community that they're volunteering for. And also it looks good on their CV. Yeah, so the aim is to make an impact on, you know, those categories, mental health and well-being. Yeah, so it's basically to help the community and you know, increase mental health well-being. Now, I mean, it was a short presentation. Again, it's not a project that I'm running, but I have been asked to share. So if you do have any more information or you do have any questions, please do email one of my colleagues, that's Juhi or Mega, who would be happy to kind of, you know, cover your questions. Or if you do have somebody or, you know, clients or service users in mind, you can also provide them with these email addresses and they can sort of liaise with Juhi and Mega, who will set up a face-to-face sort of conversation with them and take it from there. Also to say that they're both available on Tuesday, Wednesday and Thursday from 10 a.m. to 4 p.m. If you do signpost someone, those are one of the sort of days that they would you know, take face-to-face appointments with people. Yeah, so does anybody have any questions? Again, I'm not sure I'll be able to answer them, but I'll do my best. Anybody? I know a couple of you have heard this presentation. Okay, no. So did anybody else have any updates that they wanted to share with the group, you know, about services or anything that's kind of going on within your organisation that you think, you know, it would be useful to share with us all? Anybody? No? Okay. Just also to say that we have started an IT program as well, which I can share information with you guys. We've got a whole document that I will share after that kind of gives you more information, and it's just basically providing laptops for organizations or individuals in the borough that, you know, need laptops, or basically, or helping them with current devices that they already have. So for that, I will share that information via email. But again, if you do have any more questions, please do reach out to Juhi and Mega. And what I'll do is I'll put their email addresses in the chat box so that you guys can see. And if you do have, you know, any questions, then you can email them directly. Okay, so yeah, that's the updates from me. Does anybody have anything they want to share with the group? No? Also, can I ask, does anybody maybe want to do a short presentation at the next forum? Just to say that it will be on the 26th of August. Now, I know a lot of people may be going away, but yeah, if anybody does want to do a short presentation at the next mental health forum, please do email me as well, and then I can kind of arrange that with you guys. So yeah, great. I mean, if we don't have any updates, then we can finish the meeting slightly early. Okay, so
thanks for a great meeting. Well done to you as well for chairing today.
Thank you. I mean, I'm glad I didn't, you know, do a completely terrible job.
You did a great job.
Thanks, Whitney.
You're very welcome. And just quickly, I can see you've got your hand up.
Yeah, could you share the PowerPoint presentations with us, please?
Yes, please. So if everyone that's, you know, had a PowerPoint, if you can send it to me and I'll forward it on to everyone else, that would be great.
Thank you.
Okay, thank
Whitney,
you.
just to let you know
Yes.
that Friday the 26th, it's that bank holiday weekend.
Oh, okay.
Work day. I
Okay.
don't know if it might be good to get numbers. It's up to you.
Okay, what I'll do is I'll look at alternative days and kind of send it in to see who's going to be available, because if everyone's kind of going to be out of work, because probably I will be out of work myself. So yeah, thank you for that. But yeah, I'll get back to you guys with some dates and see, you know, what sort of works for majority. And then we'll take it from there.
Great.
Thank you everyone for attending.